Greetings everyone. I am delighted to welcome you all to today's webinar, Professional Development, Recognition and Development of Medical Physics in Indonesia. This session is a wonderful opportunity to understand the evolving landscape of medical physics in Indonesia and the critical role it plays in advancing healthcare. As we all know, medical physics as a field bridges the gap between medicine and physics, providing essential expertise in areas such as radiation therapy, diagnostic imaging, and nuclear medicine. The recognition and development of this profession are vital not only in Indonesia, but across the globe for improving patient care, ensuring the safe use of radiation, and advancing medical technologies. Today, we will delve into the challenges and opportunities faced by medical physicists in Indonesia, discuss strategies for professional growth, and highlight the importance of gaining broader recognition for their contributions to healthcare. And we are fortunate to have Professor Supriyanto Ardjo Pawiro, who bring a wealth of experience and insight into the topic. After obtaining bachelor's and master's degree in medical physics as a major from University of Indonesia, he completed clinical medical physics training of radiotherapy physics at Department of Radiotherapy, National Cancer Center of Singapore, funded by the International Atomic Energy Agency. He did PhD in medical physics at Center for Medical Physics and Biomedical Engineering, Medical University of Vienna, in cooperation with University Clinic of Radiotherapy and Radiobiology, Medical University of Vienna. Before his return to Indonesia, he worked at Medical Radiation Physics Section, Division of Human Health, IAEA. He has more than 80 publications, and presently he is Professor, Department of Physics at University of Indonesia and Course Director for various radiological training programs. He has taken up leadership roles in medical physics associations from the very beginning of his career and made exceptional contributions to the development and excellence of medical physics professional status in Indonesia. Through his expertise, we aim to inspire and equip you all with knowledge that can foster professional development and elevate the status of medical physics in the Asia-Oceania. Thank you all for joining us. Thank you for joining us today, Professor Pawiro. And I request all the participants to keep yourself muted and keep the video off for better bandwidth. And please type your questions in the chat box, which will be addressed at the end of the session. Over to you, Professor Pawiro.
Okay. Thank you very much, Professor Joan, for the introduction. And good evening for everyone in South Pacific Asia region to coming this webinar. Today, I want to talk a little bit in the recognition and development of the medical physics in Indonesia, already introduced by Professor Joan before. That this is the outline of my talk. That the first is the recognition of medical physics in Indonesia, education and training, grandfather certification, clinical training program for medical physics specialists, registration and re-registration of medical physicists, medical physics position Indonesia, collaboration and cooperation, and challenge. Yeah, this is the recognition of the medical physics in Indonesia. Actually, as I mentioned, that the medical physics just recognized by the government starting in 2007 through the Ministry of the Health decree, that they issuing that the decree for the medical physics as a health professional in this decree. And then this gives the impact for the recruitment from the civil servant in the country starting in 2008. And then they have some regulations starting in 2020 about the clinical radiology, as also mentioned, that the medical physicist has the radiation protection as well in the diagnostic radiology. And About the registration, I think the starting in the 2010, actually this the professional registration. We have the Indonesian Health Professional Board and medical physicists at the time is not mentioned in the regulation, so that's why the medical physicists in not in the system. But starting in 2012, that we have the regulation because the recognition of the medical physics in 2007. So that's why the medical physicist is already including in the medical on the registration of the health professional in 2012 and continue until now. And yeah, this the actually the one is for the regulation for the recognition, and then we also have the recognition from the Nuclear Regulatory Agency. I think starting in 2011 that we have the regulation. I think this the some three for the regulation. I think we have the government law. We have the regulation from the Regulatory Agency, and we have the derive in the um, uh, regulation by the Nuclear Regulatory Agency that we regulated in for the diagnostic radiology. We have also for nuclear medicine. We have the regulation in radiotherapy. Actually, we have the several changes for the diagnostic radiology. We have, I think now we have now also have the some proposal for the new regulation for the diagnostic radiology. But for the radiotherapy and nuclear medicine, still using this regulation. But the important thing on the regulation for the Nuclear Regulatory Agency that the medical physicists should be present for the licensing for the new for the machine operated by the hospital. So that's why 2011 this already starting and has to be implemented in 2016. So that's why after 2016, the recruitment for the medical physics is very high. I will talk later about some of the position in the letter for the medical physicists. And then we have for the same issue for the nuclear medicine and also for the radiotherapy. But the different story of the radiotherapy actually before 2011, actually many, I mean not many, but the medical physicists in Indonesia mostly is the radiotherapy physicists, but less for the nuclear medicine and also the diagnostic radiology. But currently, the most of the medical physics in diagnostic radiology because the huge number of the facilities, and the second is for radiotherapy, and the last is for the nuclear medicine. And this the three regulators in Indonesia. There's one for the Ministry of Education, for the Ministry of Health, and also the Nuclear Regulatory Agency. I think for the education, including for the medical physicists, the regulator is the Ministry of Education. So that's why we have to follow the regulation that the medical physicists should be come out from the Ministry of Education or university base. So that's why that we developing, I will take later as well, that we developing for the professional degree for the medical physicists in Indonesia starting in 2022. So because we have the standard for the education, we have the certification, this collaboration with the collegium or the professional society. And after output from this education will goes to the Ministry of Health for the qualification for the harmonization and also registration. So I think the Ministry of Health is to focus on the qualification for health professional, the harmonization between the health professional, regulation of health professional, and also on the continuing professional development and re-registration. So this is the main of the task of the Ministry of Health related with the professional registration. And for the use for the medical equipment, including for using for the radiation sources, so the regulated by the Nuclear Regulatory Agency. So that's why I already talked before that the medical physicists should be there, and also the output from this, we have the registered medical physicists will be asked by the Nuclear Regulatory Agency for licensing. Yeah, this I already talked before. I think in 2007 that we have very actually very lack for the medical physicists professional and mostly come out from the academic program for the bachelor and also master degree. They can come good to the facilities through the on-job training, and they will can serve for the medical physicists after the training 2 or 3 or something that 2 to 3 months in the OJOB training. And 2007, I already mentioned that the Ministry of Health issue for the recognition, and 2008, the Ministry of Civil Servant can recruit for the medical physicists. But in our data, I think I will talk later that in 5 years, I think the very less the ministry, I mean, from the civil servant recruited by the country. And 2011, actually in 2007, starting we have the grant project from the IEA for until 2015, I think, that we have the many project by the IEA to develop the human resources and also some for the equipment for the education. So that's why in 2011 we starting with regulated by the Nuclear Regulatory Agency. And then actually the medical physicist is including in the government law in 2014 and just revised in 2023 in the under number 17. So this also still including medical physics there. And we also have the standard practice for medical physics 2015 and also 2020 we developing for the professional standard for the medical physicists. So the basic level who's the how to the minimum requirement for the medical physicists and how to produce and how the minimum standard for the medical physicists including in this regulation. And for the clinical education, I think for the education and clinical training for the medical physics, and actually until 2000, that I already mentioned, it's no clinical training. So most of the medical physics come from the academic program. So we starting here in 2000, it's on-job training. And then 2007 and 2015, we have the national project A. This for the medical physics infrastructure and the candidate lecturers and also candidate supervisor. We send many candidate supervisor go overseas for training. Some candidate lecturer, including me, also get the opportunity to have the training in overseas and back together. And we piloting for the professional training and specialist training program 2016, and we starting to implement it in 2018. And because the regulation of the Indonesian at the minimum level has the should be the professional degree university based. So we developing the professional degree of medical physics in 2022 with the university based and starting in the Diponegoro University, and we will expanding to the another university in yeah, probably in this year and next year. And this is we have the 12 basic physics, the medical physics. We have the one bachelor engineering and one master medical physics and 4 master medical physics and 3 PhD in physics with concentrated medical physics. So I think I will talk the medical physics qualification because we have the regulation here that the for the medical physicists is come from that this from the academic and also plus the clinical residency program. So the minimum is level 7 here is the for the professional degree for medical physicists. So that's why that's for the medical physicists here is the BSc plus 1 year clinical training, including in level 7. And for the medical physicist specialist, or I think it is similar in the SEQMP or the ROM or the RV, nuclear medical physics, this is should be level 8. So the level 8 here is should be medical physics specialist that for the master degree and 2 year clinical training. And for the medical physics consultant, we have the specialist medical physics plus PhD here. should be we have the 3 level of the medical physics, and also it is the proposing for the some developing for the basic minimum salary in Indonesia, and we work on that in some years. And yeah, it is the some echo from the my talk that we collaborated within the Indonesian professional society, is the Indonesian Association of Physics and Medicine (AFISMI), and also the Indonesian Alliance for the Medical Physics Education Institution. That's for the developing of harmonized and also developing the curriculum to harmonize in all part of Indonesia. And yeah, this is the problem that for our university is the 12 or 13 university now is the mostly in Java Island. So this is some challenging to spread out from the medical physics in the east part and western part. So these are some challenging. So we now work together with the society and also the LNC for the higher education to developing the some education in the western part and also in the eastern part. Yeah, this is the scheme professional training in Indonesia that I think by regulation we have that for to be the medical physics, we only have the 2 intake. This the BSc in physics or the BSc in nuclear engineering with the concentration medical physics. So if the somebody has the certificate for the BSc or the in physics or nuclear engineering, so they can go with this concentration medical physics actually, that they can go for the medical physics professional degree, and then they to be licensing as the medical physicist, or we call it Indonesian physical medic. So after they completed this, they can go for the master degree and then go for the specialist training and to be the specialist CQMP is the I think recognized in the IS the for the ROM for the therapy for the and nuclear and MA. So this is the scheme for the professional training in Indonesia, and some part that for the PhD here they can also give for the specialist, but this should be from here. If not, we cannot accept it, accepting the degree that the basic level is not physics or nuclear engineering. So if the somebody doesn't have the physics or nuclear engineering, they can go. They cannot possible to go for the clinical practice. They can go for the regulatory in the regular working in the regulatory agency for nuclear agency, something like that. But it's not for in the clinical. Yeah, this is some info for the schematic. So for the basic level, we have the medical physics level 7, and we have for the 2-year clinical training for after master degree. So to be the for the medical physics specialist in Indonesia is Indonesian Qualified Framework level 8, and here for the Indonesian Qualified Framework level is 7 for the medical physics only. Yeah, I think for the developing for the clinical residency program, we have the challenge at the before is we know people certified. So that's why we developing the grandfather certification before we running for the clinical residency program. So we invite two physicists, medical physicists. One is the uh, Jerome from the radiation oncology from the National Cancer Center Singapore, certified by the American DBR, and also the Professor Kwan Hong Eng, they also certified by American. So we invite them to certify, and we have some process to certify, and we collaborate with the Minister of Health and this the university, our dean, and also some for the Indonesian Association for Higher Education. So we invited the people is already working practice in the hospital minimum 5 years with the master in physics with special in medical physics. And we invited 14 radiation oncology, 1 nuclear medicine medical physics, and 1 diagnostic radiology. And after that, only 12 radiation oncology and 1 nuclear physicist passed from the exam. So on this, the inauguration from the certification medical specialist that we issue the certificate here, and we collaborate for the 2 society. This for the professional society and this the higher education alliance. So here we issuing, and now by send this certificate, they can come go for the hospital for the Ministry of Health to register as the medical physicist in the Ministry of Health. This is the what we did for the clinical residency program for the specialist one. And we starting with the IA program in 2016 for the clinical residency program for ROM under the IA project RAS 87. So we initiated the training for the clinical supervisor. At the time, we doesn't have no experience from the clinical residency program. We work together between the voluntary for the resident and also for the voluntary for the clinical supervisor. They already certified by grandfather certification. So we have the for the clinical supervisor, and we have the 3 resident for ROM for the radiation oncology, and 1 for the diagnostic radiology. And for the diagnostic radiology, we use the mechanism for the remote residency and supervised by the Australian physicists. So this is the opening for the clinical training specialist. We invited for the NLO from the IA representative, from the national representative is connection for the IA, and also with the higher education, and we have also Ministry of Health and also from the university. So we come together this to recognize the scheme of the program and everything after the grandfather certification. So they recognize our output for the clinical residency program. So yeah, this is the we have the some supervisor through the clinical the training for this clinical supervisor, and also we have the co-supervisor, and our system is the first time we putting in the one hospital in 2 years, but after we change to rotated, it's not only in one center for the clinical residency program. So we have the assessment, we have the implemented for the assess for the clinical residency program for each semester, that we evaluate for the each semester. We come together for the clinical supervisor and also for the resident and also on the assessor. So we come together to monitor the progress of the clinical residency program. And also in the first, at the time, we under the project RAS 87 and sorry, 77 and 87. So we can invite from the international assessor from the IEA. So we this the Anne Perkins from the Australia is come to Indonesia and also to evaluate the progress or our program from the clinical residency program. And this for the DRMP, this supervised by the Donald McLean, and this the Evan, and this the supervised, and we have the some assessment for this in on-site also remotely. And the first after they completed, we have the 3 assessment in each semester. So if they completed from the assessment for the 3 semester, so we can go for the final exam in the last part. So this is the first, we have the physicists from Australia as the external examiner, and also this is for the second batch in 2021 in for the Anne Perkins to come to Indonesia for the as the external assessor. So by this, so we graduated 8 medical physicist specialists from the batch 1, batch 2. So this is from the under IA project. So by this, so we can edit for the clinical medical physics specialist and can be act for the supervisor, yeah, and also for the internal assessor. So this is the in 2002. There's the inauguration because our system that some yeah is inauguration as well. This signed by the professional society and also university. And This actually that we expanding now that by the trial in the first and the second batch for the clinical residency program. So now we have more than 16 resident, yeah, ongoing. This is we divided in the two steps. First step is didactic training. We rotated in the sub hospital for the each module, and we collaborate with the actually managed by the university, and we send to the hospital for the residency for the training. So in the first year and the second year, they can go back for the training in their home institution, and we still implementing for the assessment, and they can pass after they have the finish for the. And actually, this the funding they have that the 25 the physicists funded the private hospital, and 33 funded by the government hospital. And since 2023, the Minister had give us the funding for the clinical residency program. In the first batch is 15, and this year is 8, and next year will be 9. So this is will be for the for the improvement, because it's also correlated with the mechanism for the transformation for the radiation medicine in Indonesia to will be finishing in 2027. This is some picture from the. This is not under the A project, but this the completely is under our funding from the private, from the government, also the Ministry of Health. That the third batch is only 3. This during the COVID, and this still also the COVID. That still some this mechanism here is still using mask, and also I think in the fifth batch also, and we starting already COVID a little bit reduced, that we for the sixth batch is a big number. And then we also including here is for the Ministry of Health funding. So that's why currently we have some a lot the resident still waiting for the exam for the completion the program. And we also trial for the remote program. This is the some hospital they already have the some experience, but they have the staff retiring, and we implemented for the remote program. But this is also some challenging about the, because I think we have the trial for the remote program in the beginning, but the resident is withdrawn from the program because some issue for the communication and everything by through the supervisor. So the remote program was some challenging, but we still finalize to harmonize for the resident by now. And for the registration, actually, I already mentioned 2012. We have the medical physicists are already including in the registration for the health professional in the Ministry of Health. So this the system is the actually until 2022 is we call it the uh, under the board of the health of professional, life health professional, and this the still need the ID registration, individual registration, and also this the for the need the medical physicist registration certificate, and also they will get the registration number of the medical physicists. This is the from the 2012 until 2022. And for the registration, we have the CPD online that they have to uh, recording everything they have for the CPD activities in the CPD online. And this is managed by the professional society. We issue the recommendation letter, and recommendation letter we goes to here for the system for the registration online, and then the council will issue for the registration, re-registration for the medical visits. This some example for the registration certificate for the medical physics, and issued by the chairman of the Indonesian Council Medical Physics Health Professional. This for the basic level, and this is for the specialist one. So yeah, But because we have the new regulation for the government law, so now we changing to the new platform. This is the Satu Sehat platform. They can go, this the example from the system is the physicist Miss Ikan, that we have the here for the extension for the registration, and we also have the for the here for the new registration. So everything he put here. So this will be connect with the LMS, this the learning management system for the continuing professional development. So if the physicist is attending the CPD activities, they will connect with the Satu Sehat, and if they have the enough credit point, they can go for the licensing or registration for the medical physicists, and they will issue for the certificate similar with this certificate, but now we have the different consult because we now is combining for the medical consult and the allied health professional consult. So we only have the one consult is Indonesian Council for Health, or Indonesia call it the Konsil Kesehatan Indonesia. And medical physicist is under sub consult for the biomedical technology, and the biomedical technology has the four professional. It's one medical physicist, radiographers, laboratory technology, and also the orthotic prosthetic. So four professional in the sub console, and here is the, I mean, the sub console have the chairman, and the chairman will sign for the certificate for the registration. So yeah, there are some issue is about the new registration need the certificate competency for professional degree medical physicist. I already mentioned this, the new program, the university-based program is they have the degree is the medical physicist. For the new program is need this certificate competency. So the problem is for the re-registration. So the re-registration also need this certificate. So our homework is to develop of expanding for the professional degree medical physics in Indonesia, because we need to providing for the certificate the competency around our member now is around have the is around 700 800 people need the certificate to a registration. Yeah, this is some profiling. Sorry, it's not updated, but at least you can imagine the starting point 2016. This the I mean the increasing for the our medical physics is very fast, but before 2015, this very slow. If you see in the some publication that I think I already mentioned later that there's some small number of the medical physicists and mostly in radiotherapy. So this is we have in 2000 in May 2023 that we have here is the for the radiotherapy physicists in the for the only for the basic level. We have the resident at the time is 50 and now is around 60 plus, and we have the medical physics specialists or for the radiotherapy have the 20, the nuclear medicine only one, and diagnostic radiology now get one. F1 is passing the process, but need for the exam for the certification. So this is the some progression our medical physics Indonesia. And this our paper. I think it is wrote by me and some colleague that we collecting the data about the job position medical physics in Indonesia. So this the comparison with the new medical physics position between in clinical non-clinical institution. So that you can see that in 2015 we only have the 4 position for the medical physicists, and in the clinical and 2 in non-clinical. So in 2016 is 11, and we have the in 2021 is 120, and I think this year or the last year we also have the more than I think more than 100 around 150 new position for the government service in Indonesia in last year, and now under process, and will be in the next will be issue for the decision who will be in the government service for the medical physicists. And this is for the new medical physics position in the radiation oncology, in the diagnostic, and also nuclear medicine. You can see that in 2015, we only have the position for radiotherapy. Actually, in 2018, so 2008 to 2015, it is similar. Is you have the new position, but it's very rare, are around less than 5. But you see in the 2016, we have the position for the medical physics of 10, and we have the 17, and in 2018, 31. This is for the ROM. And then in the 2019 is 16, this is the 13, and also 36. But it's amazingly for in the diagnostic radiology is nobody here. I mean, it's very less for the medical physicists, the position. But in 2016, we increasing much. Why? Because we have the regulation in 2011 and have the law enforcement in after 5 years. So that's why after 5 years, the many institutions recruiting new medical physicists in diagnostic radiology, and currently is very the big number a year. And this is you see the some historically in 2014. This the take from the some papers. I think from some paper by Thomas Krohn, and this some survey in 2014 they have the 25 ROM. We have the 38 in 2008 and 2042 and 2014 in now. But you see in 2023, I think not less than 250 medical radiotherapy now is present in Indonesia. So you can see there's some progression of the position, and this is see that there's some position for the medical physicists to and this is the early stage before the 2016. And this is for the diagnostic and also the nuclear medicine. You see that in the yeah, for the government now, radiotherapy center is 32, and private is 18, and we have 50. This is before 20. I think the data is 2022. There's the medical physics were 125, and now it's more than 200. And previously is the ratio is 1.7, and now we have the 2.5 for in one center. So it means more than two medical physics in the center. And this for nuclear medicine is not many, so that's why it's at least one medical physics there. And for the diagnostic radiology, this is we have the 4 level for the diagnostic radiology. We have the Pratama is the basic level, and Madhya is the middle, intermediate, and this is for and the last high priority is the Paripurna. So this the medical physics services, the highest in the Madhya and also in the Paripurna, because this the Paripurna and Utama is some a little bit less different. And actually, this we see that around 651 institution covering biomedical physics service in diagnostic radiology. And actually, the number of the medical physics in diagnostic radiology around 450, and now it's ended 2022 actually, and now it's more than around 600 something. That this servicing, so it means that the one physicist can practice more than one. So this happened because we have the some limitation in the some part also in outside Java Island that they can practicing more than 3. So how the recognition? So actually, the for the licensing for radiotherapy construction, this the need the medical physics registration certificate, and also the RPO certificate, and also the physics also can be the RPO. And for the licensing for the operational, also need the registered medical physicist and also medical physics specialist resident if they running at least for the MRT. So for running the MRT, they have to recruit for the resident for the medical physics specialist already completed 1 year. And also for the insurance, the institution for the operational get the insurance reimbursement from the Minister of Health. So they need for the registered medical physicist. If not, they doesn't the medical physicist So the insurance from the our regulation, they cannot pay for the reimbursement. So this the our recognition by not only by the education, also on the clinical residency program, but also until for the recognition by the insurance reimbursement. So I think now we have some for the improvement, we have some collaboration. So we will collaborate with the government. Actually, we have the scholarship for the academic program. This through the endowment fund from Ministry of Finance and also Ministry of Health. This for funded for the academic one, but for the professional degree program, this only for the Ministry of Health because this only for the academic. But we proposing that the endowment fund can be funded also for the professional degree program. And for the medical physics specialist, until now only for the Ministry of Health and also the private or the government hospital funding the program. And this is for the academic program. Also, we have some opportunity to contribute to neighbor or some other country that we issuing this we create program. This is the exchange for the postgraduate per student, and also we have the one student from Cambodia and Zimbabwe already completed for a master program funded by University Indonesia. And now currently we have two fellow from the IEA completing for the master study in Indonesia, and currently we all have one from Zimbabwe also just registering this last year. And we have now is we have the I project, yeah, for the developing or expanding for additional facilities in Indonesia. And this also to improve, and we will concentrate for the developing for improvement to assessment for the clinical residence program and certification. So we'll send some fellow to Australia to learn for the to learn for the assessment and also the certification panel in Australia. And also we have the project for the academic funded by the DAAD. And this until 2027 is for developing of the curriculum of graduate program. This is for harmonization and the training supporting staff. We also funded by the DAAD project, and also the visit for master student to Germany, and also for the studies for the PhD. So currently we have the 6 students per year can be funded, and 2-year plus PhD student can be funded for by the DAAD. Yeah, for the challenge, I think we already talked before. I think the challenge is we have the many islands, and the population now is more than 270 million, and we have the more than 3,000 hospital and more than 7,000 diagnostic radiology devices, and we have currently have the some mandatory that the medical physical level 7 is have to produce and also for the specialist program for especially for the radiation oncology is the highly demanded because this also recognized by the nuclear regulatory agency. So yeah, this is the plan from the government. We will have the install at least 14 LINAC, a 15 LINAC, 50 SPEC, and also 103 mammography and 191 CT scanner to be placed in the 500 hospital. So this is a very big challenge for us for the mammography and also the CT scan to can be served by the medical physics diagnostic radiology. And also, yeah, this is the challenging for the diagnostic radiology clinical medicine program. So that's why we come to the minister. Our minister now is the extended. The background is physicist, so we lucky that we can, yeah, talk with him that some grant for the residency program now is already funded, and now hope that the professional degree of the medical physicist also can be funded by the Ministry of Health for the upcoming years. So this I already mentioned about our homework for the harmonization for the education, the expanding for the professional degree medical physicists, the university base, and also on the development for clinical residence program specialists in radiation oncology, diagnostic, and also nuclear medicine. So I think this is the end of my presentation, and thank you very much for your attention, and I give back to Professor Joan.
Thank you, Professor Supriyanto, for a very comprehensive representation of how you started all this and where you reached today. It's very inspirational for all of us to hear from you. And there are few questions. Can you suggest strategies to bridge the gap between academic training and clinical requirements?
Yeah, this is we some experiment to trial. So in the beginning we implemented from the clinical residency program. We actually the same with I think probably in many countries we implemented, they completed master degree first, and then we starting with the clinical residency program. This is something that the also gap that the because in Indonesia for the clinical residency program is not paid, yeah, by the hospital, but they have to also we need to pay for the training fee. So that's why this is some challenging. So we starting with the hybrid program. The clinical training is including in the more master degree program. But the challenging also this to find place to placement for the resident, because we have more than 30 students and around 10 in the radiation oncology, 5 in diagnostic radiology, and around 10 in the nuclear medicine. We have to distribute and rotate it. It is also some challenging for us. But yeah, at least that the important thing, we have the good connection. I think in the beginning that we develop the system, we training many people, and also yeah, mostly is my student before and working in the hospital. So that's why we now is collaborate with them to be the supervisor, and some we developing the structure is sometimes not easy, and some challenging for the assessment. So we mostly we come together to in discussion to develop, and some lack, and also some revise the mechanism. So yeah, the important thing is we have the good connection with the hospital, no other choice. But I think the important thing is we can use our alumni working in the hospital to be the supervisor and also the external. I think this is my suggestion.
Yeah, I think you have already answered the next question, which was the challenges you have observed in implementing practical training for students and how can they be addressed. And
Yeah.
there is another interesting question. Why need expert from Australia? Do you think your physicists are not competent to evaluate your students?
Actually, this is the beginning. This is the under IA project. At the time, is the IA project RAS 77 and 87. So this they have the funding from the IA to pay for the expert to come to the our country to have the collaborate with our physicists. So this also we also have the recent experience before to implement it from the certification program. So this is we have the from zero. So we need some guidance or some experience from them that how to make development. Actually, we have the document also involving to develop the document for the certification, but at least we need some for the practical how to certify it is not really easy one. So that's why we need some experience from the other countries to implement it in our system. But also there's some challenging because the culture is different. Sometimes it's not easy. But at least they're starting.
Yes, and you have reached somewhere which is it is very commendable actually. And
Yeah.
the next question is, how can students or institutions contribute to enhancing the course's impact on the healthcare system?
I mean the student improve or what? Sorry.
How can students or institutions contribute to enhancing the courses, the training program, masters in medical physics program, impact on the healthcare system?
Okay. I think this the two issues. The one from the academic and the second one from the professional training. For the academic one, I think we always that I think this is also the mechanism for the accreditation. We need some input from the stakeholder and alumni, and also for the user. Yeah, we always did invite them to give the feedback because I think the feedback is a very beneficial for us. That to evaluate from the I think from the internal we have the evaluation, from the external also we need the evaluation. So this is a mechanism for the accreditation. So I think the input for them is very beneficial for us. So I think this the mechanism that we need some comment and the feedback. And this from the academic. But from the clinical residency program, also similar. But I think because the clinical residency program in Indonesia, we work together. I mean, I also doesn't have the involving in the structural clinical residency program during my PhD, or this is really like on job training, and also the senior also like that. So I think we developing that the learn together between the supervisor and also the for the like me is the national representative for the clinical residency program. So we learn together. Sometimes that we have the many change for the evaluation scheme. Yeah, something that for the first batch and second batch almost quite similar because the under the AI project. Or but for the third and until now is 10 batch. The we have the some modification because we learn in the first and second batch and also in the another batch that we can implement it in the so but the mission is we need that the how the outcome of the clinical residency program have the better quality. So this is the issue. Yeah,
Yes,
I hope
thank
I
you.
answered your question.
Yes, and actually, there are very few appreciative comments. Professor Chogle has written that long way Indonesia has come and progressed remarkably in medical physics education. And
Thank you very
Dr.
much.
Sajiv, Dr. Sajiv Thomas, I think he worked in Indonesia for many years
Yes,
previously.
yes. Hello,
Yes,
Saji.
he has written that I am pleased with the results of the transformation and appreciate your efforts. And Professor Chogle has some questions too. So BSc plus medical physics professional degree, the what is the duration? Experience required to be residency supervisor? Is residency program accredited by any agency? What is the percentage of medical physicists working in radiation oncology, radiology, and interventional radiology?
Okay, yeah, this is the issue. The issue is the mechanism of the education in Indonesia. We have the call it the medical physicists, and we have the medical specialists, and we have the subspecialists. This is all follow the medical degree, medical doctors in Indonesia. So the some issue is the for the medical physics 2 years, two master degree and 2 years clinical training is too long way. And if we implemented this, we're debating for 10 years that is for we have to follow the IAS recommendation, everything. But if we implemented this, it doesn't work because what I already mentioned that we have in Java Island we have the good infrastructure, but in the eastern part and western part we have some intermediate and also in the eastern part some challenging for the infrastructure. And yeah, this is some challenging if we implemented for the directly for the medical physics specialist. So that's why the demand now is the basic level, basic medical physics degree is the solution. So this is like the bridge, as I many times I talked the this is the bridge to be the medical physics specialist. But we solving in the country, but we can expanding to be the clinical medical specialist probably in the future, probably 10 years, something like that. They can continue study and they can go for the clinical residency program, continuing for clinical residency program for the SECMP, and they could be the medical physics specialist. And actually, this the working is for the basic level. For the example, from diagnostic radiology, mostly need many people should be recruited. If you can imagine 2016 to 2022, the additional is more than 500. So if we produce the people with the sequence training, it's not possible. So that's why we implementing the intermediate strategy to produce the medical physics in basic level to practicing in hospital, because this is mandatory by the regulation. So that's why if not we produce the people, the regulation will be deleted. So that's why our recognition will be lost. So that's why the important thing, our strategy, we keep it for the regulation. I mean, we still follow. I mean, regulation for the regulator still regulate the medical physicists. We produce the people with the intermediate level, and they can practicing. So, but we still have the challenging also. This is we need some harmonization, we still some to improving the quality, something like that, some issue, but at least that we have the strategy to providing the human resources, follow the regulation.
Yes, thank you. And the next question is, what is the eligibility or recommendations your country follows for medical physics teacher to teach medical physics students at MSc level?
For the MSc level, the lecturer should be the PhD, not the choice. So that's why for in our in my university we have the master medical physics program. So now we have the 7 PhD, three in the three in radiotherapy, one in the diagnostic and one in nuclear medicine, and one still pursuing the PhD in diagnostic radiology in Leuven, and one is doing the PhD program in Aachen. Yeah, we some strategy to develop the human resource in the university, and this is very takes time. So that's why we have the strategy to recruit the young people. We yeah, looking for the funding and something like that, and they will send to the overseas for their study and also the clinical training and back to our university to be the lecturer. This is some, but this is a very takes time. So that's why I think if the some university want to offering this, is you have to prepare not only for human resources but also for the facilities, something for the practical, for the detectors and everything. So I think this is the big issue as well for the developing medical physics education.
Yes, thank you. And it's really commendable that irrespective of all these challenges and lack of manpower, you could implement that every diagnostic radiology department also needs a qualified medical physicist. That's, I think, you are the only one in the area region to have this regulation. And
Yeah, actually,
yes.
yes. Actually, yeah, currently for the only one now is F1 completed, and we starting now with the hybrid program. We have the 5 resident now, including in the master degree, following the residency program. Actually, but not completed yet. But at least, but by the regulation, only the radiotherapy and nuclear medicine I mean, the requirement has the specialist one or the SEQMP. SEQMP in the radiotherapy and radiation oncology and nuclear medicine is regulated by or recognized by the regulators, by the nuclear regulatory agency. So for the example, I already mentioned before, for the new radiotherapy machine, hospital in want to install the MRT or the high tech for the radiotherapy machine, they have to recruit or they have to send the training the student to the hospital for the through the residency program. So that's why during the installation or the commissioning, they already have ready with the resident have at least 1 year experience and left already for the assessment for the passing for the residency program. But for the diagnostic, we decided not pushing the regulator to put recruited the specialist in diagnostic radiology. Why? Because this is a very bottleneck. Because we have the 2,000 institution, we have more than 7,000 diagnostic radiology machine. If we regulated this, so we cannot possible. It's not possible to providing the human resources. So that's why we only currently we only putting only for the nuclear medicine and radiation oncology, but we progressing to providing the people with the specialist training. But this is only providing they or probably they have the experience, so they will recruit the most experienced than probably the basic level. So I hope this is working, but this time strategy that we providing the people first, and probably they will yeah, Sufyan or recognize them that okay, all these people with the residency program with better knowledge and better experience, so they will recruit them. So, but we not putting in the regulation because there's some bottleneck issue.
Yeah, thank you. Before we conclude, I think we have many veteran medical physicists with a lot of experience working in the field of accreditation, regulation, and harmonization. And I would like to request if any one of them would like to make some comments online. Professor Chowgule, Professor
Uh,
Subhash, Professor Sajeev.
yeah. Just I hope you are able to listen to me.
Yes, sir, we
Yes,
can hear
yes.
you.
Okay. So congratulations, Supriyanto. I know since 2008 I'm following because in 2008 we got candidate from Indonesia through IAEA for 6-month training. You have
Yes.
come a long way. And as mentioned by Mary Joan, I always say also that it is one of the countries, Indonesia, where in radio diagnosis and intervention radiology, the medical physics services is important and made mandatory, and that need to be done because this is the one area which is very much neglected, and this is a very highly contributing radiation doses to the humankind. That's one good thing. So medical education program you have done very wonderfully and progressing very well, because it takes a lot of time and efforts to do those things, to bring into things, but you have done that thing in a way, and very nice and appreciable is that medical physicists are recognized as the health professions. That is very important. Registration of the medical physicist as a health profession is happening. That is a highly appreciable, and I do understand when the program starts with the help of IAE and other organization. Initially they send the people, and that is how Australia external examiners were needed to maintain the quality and appreciate them. And slowly, when you get people in-house in your own country, you can continue that thing. As a chair of the ETC, any kind of support, any kind of help regarding the education training program and things, you can reach out to me. And once
Yes.
again, I thank Mary Joan for organizing this wonderful program, and Supriyanto giving the overview. I was reading your papers, but so extensively data, I could listen to you. Thank you very much.
Thank you very much, Arun, for comment.
Thank you, sir. Anybody else would like to comment? Okay. I think thank you very much, Supriyanto, for this very comprehensive presentation on how you did the job, and you have done it excellent. And many countries in the AFOMP region are in the process of getting medical physics professional status, getting it recognized in the governmental level, and regulatory agencies are there most of the places. But everywhere we need to go miles ahead. But then, like, we are very hugely different in various aspects. Like, each country has its own merits and challenges. So everybody will have problems of their own in getting the things done. So yours is like a pathfinder and a model for everybody to follow or start learning from, and adapt some tips in getting things implemented in their own places. So thank you so much. And thank you so
Welcome.
much, all the participants, for attending. And I hope this session will continue to promote further discussions and deliberations on how to make the professional status of medical physics in AFOMP to a higher, better level. Thank you so much, Professor Pawiro, and thank you everyone for joining us. Looking forward to meeting you all in the next webinar.
Okay, thank you very much for the invitation.